The state of Pennsylvania is on the brink of a crisis that could affect millions of residents as Governor Josh Shapiro faces an unprecedented budget deadlock that has left schools, hospitals, and public services hanging in the balance. As the calendar ticks past the June 30 fiscal deadline, funding that hundreds of institutions depend on has yet to be released, and the consequences are immediate and alarming. Across the state, districts are scrambling to pay staff, hospitals are postponing critical purchases and upgrades, and local governments are forced to patch together temporary funding solutions just to maintain basic operations. This is not a distant, abstract problem, it is happening right now in every corner of the state, from Philadelphia to Pittsburgh, and it is threatening the stability of services millions rely on every single day. Families are facing uncertainty over whether schools can open on time or maintain essential programs, while hospitals struggle to maintain staffing levels and pay for life-saving equipment. Social services that protect the most vulnerable citizens, including children, the elderly, and low-income families, are effectively frozen until lawmakers break the deadlock, creating a humanitarian and administrative pressure cooker. Governor Shapiro, who has become the public face of this standoff, has repeatedly called for compromise, but partisan divisions within the legislature have escalated tensions rather than resolved them. The lack of a signed budget is now not just a political battle, it is a real-world emergency, with agencies forced to delay payments for critical services. Statewide, education administrators are sounding the alarm. Teachers are waiting for paychecks, districts cannot finalize contracts for the year, and planned school infrastructure improvements are indefinitely postponed. At the same time, hospitals that rely on state reimbursements for Medicaid and other essential programs are facing operational strain, threatening patient care. Local officials warn that without immediate action, essential programs could shut down entirely, and the financial ripple effects will reach every Pennsylvanian. Families already stretched thin by inflation, rising utility costs, and housing pressures are now facing the additional burden of a state government gridlocked at a time when every dollar counts. Public outrage is mounting as residents see the tangible effects of inaction. Parents report closed classrooms or delayed school openings, while healthcare workers face uncertainty over their employment and the stability of the services they provide. Libraries, child welfare agencies, and community programs face the stark reality of not knowing whether they can continue operating at all. Each day the deadlock continues, the financial strain compounds, creating an environment where emergency decisions are necessary just to keep essential functions alive. The stakes are high, millions of lives are touched by these delays, and the public is growing increasingly frustrated as they see political leaders trading barbs, while the systems they depend on teeter on the edge. What makes this crisis particularly alarming is how avoidable it was. Warning signs had been clear for months. Projected shortfalls, deadlines for legislative action, and repeated calls for compromise were all documented and communicated, yet partisan gridlock and political maneuvering prevented any resolution. The longer this stalemate continues, the more difficult it will become to restore confidence in the state's institutions. Pennsylvania is not just facing an erosion, it is facing an erosion of public trust, disruptions to essential services, and the looming threat of longer-term economic consequences. And while the media focuses on statements from Governor Shapiro and legislative leaders, the human impact is quietly escalating behind the headlines, with families, school districts, hospitals, and communities feeling the pressure in real time. The tension is palpable, the stakes are high, and the question on everyone's mind is simple. How long can Pennsylvania survive under this strain before critical systems begin to fail entirely? Pennsylvania's budget lock didn't come from nowhere. It is the product of months of political gridlock, rising partisan tension between House and Senate leaders, and an inability to reconcile sharply different spending priorities, leaving the Commonwealth without an enacted spending plan long past its June 30 deadline and delaying critical funding for schools and human services, a situation that has now stretched more than 90 days, with lawmakers still unable to agree on how to allocate roughly $50 billion for the fiscal year. In the first weeks of the impasse, Pennsylvania's budget process stalled as the Democratic-led House and Republican-controlled Senate deadlocked over how much to spend overall and how to distribute funds for key programs, with disputes over revenue, social services, and education funding blocking any compromise. As negotiations dragged, Pennsylvania officials warned that without an enacted budget, the Commonwealth could not legally release funding for many core functions, meaning payments to schools, counties, child welfare services, and critical safety net programs were put on hold. The impact was immediate. School boards reported that without state allocations they could not hire necessary staff, make repairs, upgrade technology, or plan for the academic year, while counties faced the prospect of borrowing funds or issuing costly short-term notes to keep services running. Letters from the state's budget secretary outlined at least $2 billion in delayed education funding and more than $500 million in health and human services payments, including to county child welfare offices, ambulance services, homeless shelters, and libraries, all essential parts of local safety nets. By October, districts were waiting on an estimated $3.8 billion in state funding, forcing some to use reserve funds and take out loans simply to cover payroll and basic operations, with interest costs ultimately passed on to local taxpayers. The stalemate also revived painful memories of the 2015 budget impasse, a 9-month deadlock that led over 100 service providers to borrow more than $172 million just to keep programs afloat, costs they are still paying back today. Behind the scenes, lawmakers and political operatives knew the deadline was looming. Even top appropriations chairs publicly acknowledged that negotiations were dragging far past when a budget should have been passed, yet ideological wrangling over spending levels and revenue sources prevented swift action. Even as the Commonwealth is legally required to continue core health and safety functions, including Medicaid, unemployment compensation, and state police operations, the delay created a fiscal limbo for hundreds of county-level services and school programs that rely on predictable state support. The resulting cash flow uncertainty forced some counties to consider furloughs, scale back social services, or redirect funds from other priorities, while nonprofits and human service providers faced the real threat of program closure or staff cuts, with long-term impacts that could linger well beyond the resolution of the deadlock. What the public wasn't told in real time was how deeply the impasse undermined local planning and confidence. Budgets at the school and county level operate on tight timelines, and the absence of state allocations made it nearly impossible to set wages, staff schools, or plan health services, creating a cascading effect of uncertainty across the Commonwealth. Only after more than 4 months and continuous negotiations did lawmakers finally pass a roughly $51 billion budget, ending what insiders described as one of the longest state budget impasses in recent U.S. history, with governor and legislators forced to compromise on funding priorities to break the stalemate. The real consequences of Pennsylvania's budget deadlock are no longer abstract projections. They are now hitting families, schools, hospitals, and businesses with brutal immediacy. Across the state, school districts are facing a financial squeeze like never before. Without the release of state funding, administrators are forced to delay or cancel critical programs ranging from special education services to after-school initiatives. Teachers and support staff, many of whom already struggle with stagnant wages, are waiting anxiously for paychecks that may be weeks late, creating a climate of uncertainty and fear. Parents are left scrambling, unsure if classrooms will be open or if extracurricular activities will continue, and families relying on school meal programs face disruptions that could leave children hungry. This is happening in your community, affecting ordinary citizens who have no control over the political stalemate but bear the full weight of its consequences. Hospitals and healthcare providers are feeling the strain even more acutely. Facilities that depend on Medicaid reimbursements and state grants are now forced to make impossible choices: delay purchases of vital medical equipment, reduce staff hours, or postpone essential patient care. Nurses and medical technicians are reporting growing frustration as they are caught between their commitment to patients and the financial uncertainty imposed by bureaucratic gridlock. Elective procedures are being postponed, community clinics are reducing hours, and vulnerable patients face longer waits for care, jeopardizing lives and undermining trust in the healthcare system. The ripple effect of delayed funding reaches every corner of the economy. Local vendors supplying hospitals with food, equipment, and services face unpaid invoices, and small businesses dependent on steady contracts struggle to stay afloat, creating a cascading economic impact that cannot be ignored. The impact on the broader community is equally stark. Local governments are grappling with frozen budgets, which affects essential services like public transportation, sanitation, and law enforcement. Streets that should be maintained are littered and neglected. Public parks and recreational programs are reduced or closed, and emergency services are stretched thin as municipalities try to operate under constrained resources. Businesses face uncertainty as they cannot plan for payroll, inventory, or expansion without knowing whether state funding will come through. The economic confidence of the region is eroding, with investors and entrepreneurs hesitating to commit to projects when the state's financial future is unresolved. Communities already struggling with high inflation and housing pressures now face another layer of instability, compounding the hardship for millions of residents. The human stories behind these numbers are heartbreaking and immediate. A single mother in Allentown worries whether her children's school will open on time and whether she can keep her part-time job while juggling childcare. A nurse in Pittsburgh faces the gut-wrenching reality of turning away patients or delaying treatment because hospital resources are frozen mid-budget. A small business owner in Harrisburg is forced to lay off staff temporarily because contracts with state agencies are stalled. Each individual narrative adds urgency and weight to what might otherwise seem like abstract policy disputes. The deadlock is not just a political issue, it is a daily crisis affecting real lives, jeopardizing education, healthcare, livelihoods, and the very social fabric of Pennsylvania. Despite the mounting chaos, those responsible remain largely untouched. Governor Shapiro and legislative leaders continue to negotiate from the halls of power while families, workers, and institutions bear the consequences of inaction. The public watches, frustrated and alarmed, as the gridlock persists, realizing that the stakes are no longer theoretical. Every day the deadlock continues, the human and economic fallout deepens, leaving a state on the edge of systemic failure. Pennsylvania is experiencing the tangible, painful consequences of political paralysis, and the question looms ever larger: how long can ordinary citizens withstand this pressure before the system they rely on begins to unravel entirely? The question everyone is asking now is simple yet explosive: who is truly responsible for the crisis unfolding across Pennsylvania? While families scramble to keep schools open and hospitals running, the finger points squarely at the leadership in Harrisburg. Governor Shapiro, as the state's chief executive, bears primary responsibility for ensuring that the machinery of government functions without endangering millions of lives. Yet despite repeated warnings from auditors, education boards, and health administrators, the governor's office has failed to secure a timely resolution, leaving agencies paralyzed and budgets frozen. Legislative leaders in both chambers share the blame, wielding political leverage in a way that prioritizes partisan maneuvering over public welfare. Weeks of negotiation have produced headlines but no tangible relief, and the consequences of inaction are being borne entirely by ordinary citizens. The controversy deepens when examining specific decisions and inactions. Public reports indicate that warnings about budget shortfalls and the need for emergency appropriations were issued months ago, yet lawmakers delayed any decisive action. Key committees charged with fiscal oversight allowed deadlines to lapse, and internal memos show repeated alarms that went unanswered. Citizens were assured that essential services would be maintained, yet schools are cutting programs, nurses face staff shortages, and hospitals are forced to ration care. The contrast between promises made in press conferences and the reality on the ground is stark, fueling outrage and distrust. Pennsylvania residents are left asking, how can leaders talk of stability while the foundations of society, education, healthcare, and public safety are crumbling around them? The political spectacle only adds fuel to the fire. Governor Shapiro's office has faced criticism for focusing on messaging campaigns and public statements rather than immediate action. While families wait for clarity on funding, the administration releases glossy reports detailing long-term plans, creating the appearance of responsiveness without solving the present emergency. Legislative leaders, meanwhile, are caught in procedural wrangling, leveraging the deadlock to negotiate other political goals, leaving millions of Pennsylvanians in limbo. Every misstep, every delay, and every avoidance of accountability compounds the public's frustration, turning what might have been a temporary budget dispute into a full-blown crisis of trust. The fallout is not limited to politics. It has sparked widespread public outrage. Protesters have gathered outside state buildings demanding accountability. Citizens have flooded social media with stories of disrupted services, and advocacy groups have filed complaints about the tangible harm caused by delayed appropriations. The anger is understandable. Indecisions impact children's education, patient care, and economic survival. Leadership is no longer an abstract concept, it is a matter of life, safety, and security. Analysts warn that if action is not taken swiftly, the consequences could escalate. With more institutions forced to cut critical programs, more families left without basic services, and the state's credibility eroding both nationally and locally. The stakes are higher than ever, and the warning signs are clear. Governor Shapiro and legislative leaders are not just facing political criticism, they are under the microscope of a public that demands immediate action. With every day of deadlock, the question grows more urgent: how long can Pennsylvanians endure the consequences of inaction before the social, economic, and human toll becomes irreversible? The crisis has exposed the fragility of systems we take for granted, and the controversy surrounding leadership decisions has turned an ordinary budget negotiation into a scandal that threatens to define this administration. In Pennsylvania, the fallout is no longer hypothetical, accountability cannot wait, and every delay tightens the grip of a crisis that refuses to abate. The future of Pennsylvania hangs by a thread, and the consequences of continued inaction are both immediate and catastrophic. Experts warn that if Governor Shapiro and the state legislature fail to resolve the budget deadlock swiftly, schools could face permanent program cuts, leaving thousands of children without access to essential education, after-school programs, and special services. Hospitals, already struggling to operate under constrained funding, may be forced to reduce staff, delay critical treatments, or even close wings entirely. creating a healthcare emergency that could ripple across the entire state. The economic toll is equally severe. Small businesses dependent on public contracts risk closure, unemployment could rise sharply, and consumer confidence may collapse, leaving entire communities in financial turmoil. These are not abstract projections, they are the tangible realities poised to hit Pennsylvania if leadership continues to stall. Long-term studies indicate that sustained budget paralysis will exacerbate social inequality. Vulnerable populations, low-income families, the elderly, and marginalized communities stand to lose the most, widening the gap between those who can weather the storm and those who cannot. Education deficits today will translate into workforce shortages tomorrow, leaving the state less competitive and residents trapped in cycles of poverty. Healthcare deficits will strain public hospitals and private clinics alike, leaving millions without access to preventive care or emergency treatment. Economists warn that this cascade effect could depress Pennsylvania's GDP, reduce tax revenue, and force even more austerity measures, locking the state into a downward spiral for years to come. The human cost is equally devastating. Imagine parents forced to make impossible choices: which bills to pay, which children's programs to forego, which medical procedures to delay. Nurses and doctors working double shifts to cover staff shortages, knowing they cannot provide the care patients desperately need. Teachers watching classrooms shrink as programs disappear, witnessing the future of their students slip away due to decisions made hundreds of miles away in Harrisburg. These aren't just numbers, they are lives on the line, trust eroding, and hope fading while political games continue at the top. What makes this crisis even more alarming is that it is entirely preventable. Warnings were issued, deadlines were missed, and the infrastructure for action exists, but political maneuvering, delays, and bureaucratic paralysis have allowed this disaster to grow unchecked. Every day the stalemate continues, the damage compounds, and what might have been a solvable crisis becomes a generational catastrophe. Leadership is no longer a matter of policy, it is a matter of accountability, morality, and the survival of institutions that citizens depend on daily. The final question hangs in the air like a storm cloud: how long will Pennsylvania endure this avoidable catastrophe? The choice is stark. Immediate action could stabilize schools, hospitals, and local economies, while continued inaction promises cascading failures, social unrest, and a state fundamentally weakened for years. The clock is ticking, and the fallout will not wait for compromise. This is not speculation. It is reality knocking on the doors of every city, town, and township in Pennsylvania. The citizens deserve answers, solutions, and leadership that prioritizes their welfare over politics. Do you think Governor Shapiro and the legislature are ready to act? Or are we already witnessing the unraveling of the systems that hold Pennsylvania together?